So we are discussing COVID-19 pathophysiology. COVID-19 name comes from a coronavirus disease 2019 and SARS-CoV-2, severe acute respiratory syndrome causing coronavirus type 2. Obviously, this virus is called coronavirus, obviously, because of its crown-like spikes. The corona word comes from Latin. That means crown. So it has like crown shape. The spikes in the membranes make it look like a crown. If you look at the structure, we have membranes, envelope, RNA proteins, esterase dimers, and the main important things are the spikes. The spikes. This is the structure. Now, how it just spreads? Anybody who gets it, he either coughs or sneezes. Millions of coronaviruses are coming out of our of the mouth. So they remain in the air for at least 8 hours. Previously, it was told it was only 3 hours. It remains on the surface for 24 hours. So it is airborne always, and it also remains on the surfaces like tables, chairs, etc. for 24 hours. So how do we get it? We either go in a place where somebody has already coughed or sneezed, so we inhale that particle. It goes into our lungs, especially into the alveoli, going to the trachea, the bronchioles, and into the alveoli. Alveoli are the main culprit, main sources, main targets. This is where it has to go. It loves damaging the alveoli. Okay, like the other viruses, like influenza virus. In a lung, there are millions and millions of alveoli. If you look at the alveoli structure, like a single alveolus is composed of type 1 pneumocytes and type 2 pneumocytes. The type 1 pneumocytes is the one that makes the membrane structure, and the type 2 pneumocytes are the one that make the surfactant production. And the endothelial membrane is made by capillaries. So all this is the alveolar structure. So we'll see it how the virus goes into it and how it damages it. Okay. So in the alveoli we have a special structure called ACE2 receptors. These receptors are the one that it needs to enter into the type 2 pneumocytes. So the alveoli has type 2 pneumocytes, and these type 2 pneumocytes have ACE2 receptors. The virus goes through these receptors, injects its RNA, and the RNA goes into the cell and starts replicating. And this makes more RNAs, and the RNA also goes into the ribosome, causing the translation, making the structural component of the virus. So all the structures, the spikes, the envelope, all are made, the RNA is made, and they go into the membrane of the cell, thus producing millions and millions of new COVID-19 viruses out of the cell membrane. So they use our cells and make lots and lots of different viruses. So what happens? How the damage happens? Step one is when the COVID-19 enters into the lungs, especially into the alveoli, it starts immune cascade. The macrophages, who are the first respondent, start rushing into the alveoli. Once they come into the alveoli, they release IL-1, IL-6, and tumor necrosis factor alpha, the three things that it has. IL-1 will go and make you feel feverish, so you will have fever. Fever is the first symptom, just remember that. So, first is fever. The next step is the IL-6 and the tumor necrosis factor alpha. What do? They cause the endothelial increase in the permeability of the capillaries. So they cause vasodilation. Once the vasodilation occurs, the capillaries that are running side by side of the alveoli, they become porous. So the fluid goes from extracellular into the alveoli. When it goes into the alveoli, it goes into the lungs. If the alveoli is filled with fluid, which is called alveolar edema, then when there are millions and millions of alveoli filled with fluids, will make the whole lung filled with fluid. This is called ARDS, the acute respiratory distress syndrome. Okay, so in acute respiratory distress syndrome, we have the whole lung filled with fluid, and this happens so quickly that the body is unable to respond to it. So the whole lung is filled with fluid, and the patient goes onto ventilator. Okay? Okay, the next step, when the macrophages aren't doing so much, they're killing some of the COVID-19, but they're causing more damage. Now the neutrophils come into the party to help the macrophages, and once they come into it, they release cytokines and the proteases, and this damages the type 1 pneumocytes. And the type 1 pneumocytes are the one that are making the lining of the alveoli. So the holes, now previously the alveoli were filled with fluids, now their structure is being damaged by the proteases. So we're damaging the alveoli and filling it with fluid. This is the time the patient will start feeling, obviously, the ARDS, and the patient will have shortness of breath. So fever and shortness of breath, the two main symptoms. Now, next what happens is when you have damaged your alveoli and filled it with fluids, your protection is already gone. The other bacteria that were circulating in the blood or anywhere will get into the alveoli as well, and so they will cause another infection over COVID-19. This is called superinfection. So this superinfection, the bacteria now was into the lungs, will go into the blood and causing sepsis overall. So this is the step 2. Obviously, now at that moment you will have hypoxia, the shortness of breath, and cough. Obviously, the lungs are being damaged. So the cough, shortness of breath, and the fever, the main 3 symptoms that we had. So here we have only dry cough, shortness of breath, and fever, the 3 main symptoms. Okay, the sympathetic system kicks in as well. It will increase your heart rate and respiratory rate to cope up with the hypoxia. Obviously, it won't be able to do it completely. So the patient will have to go onto ventilator when the ARDS happens. So ARDS, sepsis. Okay, this is how it is damaging. So all this, when combined, we call it SARI. Severe acute respiratory infection. It's a severe infection. It's a severe acute respiratory infection, which is sepsis and ARDS combined, causing a worse outcome of COVID-19 pneumonia. So that's how it works. So what happens next? When we have sepsis and we have lungs filled with fluids, what happens? In the sepsis will cause more release of the interleukins, that will cause a whole vasodilation of all the capillaries of the body, decreasing the peripheral resistance, causing hyperperfusion, hypertension, and the blood flow to all the organs will be reduced, leading to a multi-organ failure. So this is the picture that we are all seeing. Sepsis, ARDS, and a multi-organ failure. When will you know it's a multi-organ failure? When you have raised ALT, raised AST, and serum creatinine. So these 3 processes are the one that killing the patients in COVID-19. So we had the virus going into the body, causing damage to the alveoli, filling it with fluid, causing ARDS, causing superconsolidation. So main symptoms, fever, shortness of breath, and cough. And ultimately it will lead to sepsis and multi-organ failure. And that is how it causes the damage.